I'll go just a little bit back and show you where we were and then where we are now. So adjuvant radiation therapy has been given to all stage 1, or high risk stage, intermediate and high risk stage 1, stage 2 disease, stage 3 disease. But when we look at all these trials together, have addition of radiation therapy given us a better survival outcome? Answer is no. It is not giving us a better survival. Has it given a better local control so you don't get the local relapse of the tumor? Yes, definitely it has. But why it's, if you have a better local control, why it's not showing in the overall survival? This is because the patients who did not receive radiotherapy and had local relapse, they could be salvaged by radiation therapy at the later stage. In this way, you would avoid giving radiation therapy to about 80-90% of the patients, only giving to them who need it at the time of relapse. We in Denmark did a real world study to look at all our cancers, how they're doing, and we divided them into low, intermediate, and high grade according to the classification. We looked at how many patients die from cancer, these endometrioid cancers, how many die from cancer in different stages. As you can see, low grade 3%, and it's going up to 34% in the high grade. Then we looked at how many of these patients died of isolated vaginal recurrence, that's a local recurrence. And if you look here, the low grade only 0.3 fortunate, 0.4 in intermediate, 0.5 in high, and 1% in high risk group. That's telling us that patients do not die of local relapse, they die of distant relapse. And that's what we have to control in this disease. So then, who are the patients who should receive any radiation therapy? Basically, what we do in the Nordic countries and many other countries, that patients who have tumor which has spread across the uterus, in the fatty tissue, in the pelvis. These are the patients typically after surgery we would offer radiation therapy, because there is a very high risk that we do not have a good local control and we have to give them radiation therapy. All other, for example, if patient's tumor has spread in the lymph nodes, we do not treat them with radiation therapy. Why? Because spreading to nodes is telling us that there is a very high risk of distant metastasis, and not of local disease. So they have to receive some systemic therapy, which is chemotherapy, and now we would see other therapies coming in.